service. So for those of you who don't ride or haven't heard anything about what I do, I started as a dressage trainer, that's my training really. And then due to my own difficulties with my own riding and also trying to help my clients, that kind of led me to Pilates, which was in Italy at the time. I've managed to train most of the horses I've dealt with to a reasonable level just by sort of using myself in probably a not very efficient way, but I could get by. But when it got to a certain level of dressage, which is my passion, it just kind of appeared that my body would do what I needed it to do. My coaches couldn't really see that, and a lot of focus was placed on the horse and getting the horse to do things, and not really understanding that it would need blocking the horses from doing their job properly. So the Pilates took me down a path which was fascinating, that led me to the biomechanics coaching, which was really revolutionary. And if you don't know anything about riding horses, I'm just going to show you a little video so that you can hopefully see it's not just sitting on a horse. I'll just let that play. And in Australia, and I work quite closely with a couple of research scientists in Australia, that actually there are more injuries and deaths related to horse riding than any other non-human species, which, considering what goes on in Australia and all their crawlers and things like that, is quite significant. Now, the reason why, or one of the reasons why horse riding is dangerous, is because horses are prey animals, so they're basically frightened of most things. And we have to train them to get used to pressures and traffic and any situations that they are not used to. And they're very, very instinctive and hardwired, really, to be picking up instantly on any perceived danger that is around them. They're basically like massive rabbits. So they're very active, they move very quickly, and so that is a requirement of the riders to be able to control that, stabilise that, and minimise really that kind of instinctive reaction from any horse that they might be dealing with. So how can intrinsic biomechanics help the riders? Well, the good news is that they're quite tapped into this at the moment. Core stability is already known as the holy grail, really, of what riders are looking for. And most disciplines within the equestrian world, now, I showed you some dressage, I showed you something in cross country, but there are loads of disciplines within equestrian sport. And most of them are already locked onto the fact that they need more core stability. However, biomechanics is the latest buzzword. Anybody who offers lessons with the word biomechanics in it is very trendy at the moment. So you can, any riding instructor who offers lessons focusing on the rider's biomechanics or the postural position or this sort of thing will be quite popular. And of course, we know that that's really, they're dealing with the extrinsic biomechanics, and dealing with the intrinsic is not quite as well known yet, but it is. It's getting more well known, and hopefully people will be locking on to the importance of how it integrates into performance. So one of the roles of the riders is to be actually just able to absorb the horse's movement going on underneath them. So the first part of the rider's body that has to receive the movement forces from the horse, does anybody know what that is? The pelvis, yeah, absolutely. So as the horse starts to move, the rider will receive that and start to process that through the pelvis. If that pelvis isn't working as effectively or efficiently as it might do, there's our first blocking point, really, of where the rider's going to be dealing with all that oscillation and movement going on underneath them. So I describe to my riders that what they need to look at in terms of improving performance is form and also function. So form to them relates to how they're sitting on a horse. So you'll see from the little picture there how their weight is distributed in the saddle between the left and right sides, how their legs are hanging on either side of the horse's barrel, the height of the shoulders, the position of the arms, the angles of the joints, all that sort of thing is looking at the form, which is the extrinsic biomechanics. And that is really important because people are in really bad habits, postural habits, which Jen was talking about earlier. Actually, you really introduced my presentation perfectly with your breathing, so thanks for that. And if a rider is looking as though they're sitting on a horse like this, that is not going to help the horse's weight curve. But the function, as we know, is massively influential. So the function is going to be looking at the intrinsic biomechanics, so how the nerves and muscles of joints are creating that picture that we can observe from the outside when the rider is on the horse. It's really important that we are able to sit evenly in the saddle. If you imagine a backpack that you might put on your back that's loaded a little bit over to one side, it's not quite central in the middle. As you've got that backpack on throughout the day, you're going to be kind of trying to shrug that all the time to make it a bit more comfortable for you to carry it and getting it in the middle of your body. That's a bit like how the horse treats the rider. So if a horse is dealing with a rider who's not sitting evenly on their backs, usually one of two things will happen. The horse will either try and constantly move underneath the centre of the load. So if the rider's sitting over to the right, for example, the horse is constantly drifting to the right and responding to that unconscious weight signal that the rider is giving them. They'll then have to override that, if they don't want the horse going to the right all the time, with pressures with the legs and arms and so on. We want to eliminate any unnecessary pressures going onto the horse as much as possible, so we can be as ethical when we're dealing with him as we can be. That's one type of compensation that the horse will make, or, for instance, if the the rider's over to the right, the horse will be leaning to the left all the time, so they're both going in opposite directions. A little bit like two people at the end of a road with a tug of war. Nobody wants to let go because the whole thing will collapse in the middle. But it is the rider's responsibility to find out where central is and be able to maintain that. We do need fine control of the core muscles. The pelvis and our trunk is really the epicenter of our influence over the horse's balance. So being able to engage muscles quite specifically, and also really importantly releasing those muscles, gives signals to the horses for what we want them to do, in addition to the pressures we can apply with the legs and also the arms. So I mentioned extrinsic biomechanics and intrinsic biomechanics. There's loads and loads and loads going on in the field of extrinsic biomechanics. There's loads of research, a lot of money is being pumped into improving performance through research and studies and so on and so forth. Because of the success we've had at the 2012 Olympics, and we're wanting to emulate that in Rio as well. So this next few slides is just to show you really the things that are going on. There is lots of fantastically high-tech gizmos, gadgets, software programs looking at gait patterns, foot balance, and also limb loading and joint angles. Anything you can possibly imagine the data collation to do with this is quite mind-blowing. These are courtesy of a friend of mine who may have heard of him before, Russell Dwyer of Sensible Biomechanics, and he's massively into the extrinsic side and presents all over the place. And the intrinsic stuff fits absolutely superbly well with what he's doing. This is a pressure sensor on the horse's girth, which picks up if the stride length of the horse is changed when different pressures and different girths are used. So equipment's being tested all the time. And this shows pressure through the saddle, where it's actually slipping to the right. You can see a little graphic on the left, and the peak pressures and things going onto the horse's back. Now, just to the next slide, I want to. Next one. That's just an example of different studies and things that are going on in the moment in terms of extrinsic. But in terms of what your rider's motivations might be in coming to you for help, one of those motivations, if you just look down this side, is that the saddle moves to one side. So a lot of people will be sent to you because they think they're crooked and then they can't keep their saddle straight. The rider's balance and symmetry and pelvic function is hugely influential on whether the saddle actually stays straight on the horse's back as it moves. So for instance, if the rider's pelvis is slipping over to one side and also particularly rotating, that will push the saddle, the back of the saddle, the front of the saddle into different directions, which can eventually actually cause damage not only to the saddle but the horse's back itself, and in serious cases it can cause lameness. It can certainly influence the horse's gait patterns. But the same works the opposite way around as well. So the horse's movement is massively influential on how the rider feels and absorbs that shock. So the horse, the saddle and the rider are kind of one interlinked package, if you like. There's been some interesting research done by Sue Dyson at the Animal Health Trust on saddle slip, and they found that they assessed 128 horses, and 71 of those horses were lame in one or both hind legs to different degrees of subtle lamenesses, and 71% of those horses had saddle slip to one side. Now, when they actually medicated the horses to mask the pain so the horses couldn't feel any of the pain, they reduced that by 97%. So 97% was actually resolved. The riders were sitting perfectly level. So it can be the rider, it can be the horse, or it can be the saddle that's influencing that sort of thing. Interestingly, the horses that they assessed, the ones that they know, the horses that they know had sacroiliac issues or back pain, none of those horses actually had saddle slip. They were the lame horses. So there we go. Other motivations, loads of riders will think they've got no core stability, so they're in instructors and things will send them off to strengthen their cores. They go to gyms, they go to core classes, they go to Pilates, this sort of thing. Often I find that it's not so much core stability, it can often be to do with different things like release and relaxation, and absolutely to do with the pelvic mechanics, the spinal mechanics and the shoulder mechanics as well. So when they feel that they're bobbling about all over the place, they can't move with the horse, going through the intrinsic biomechanics program can make a huge difference without necessarily even particularly focusing on core strength. Often they'll find it easier to ride one way than the other. Pelvises, as I mentioned, that get stuck in rotations and tilts could be giving missed signals to the horse about where to carry itself. For instance, a stiff thoracic spine which can't rotate means that the rider's body may well get stuck in one direction. That can mean that their rein contact feels uneven. The horse finds it difficult to go the opposite way because the rider's constantly stuck in what the horse perceives to be a turn in one direction. They often can't use their legs very easily on one side compared to the other. That again is relating to the pelvis and how the pelvis is sitting on the saddle, and we'll come back to that later as well. Sometimes every horse that they ride shows the same issues, and they'll always have particular difficulties with movements one way with every horse that they ride. So that's a bit of a clue that it's not the horse or the saddle path, but it is the rider. Now I've put pain right at the bottom. You might think that's a biggie, and it is, but riders are particularly stoic, I like to think. They won't go and seek any help for themselves until they basically can't actually get on the horse or go and look at the horse's stable. And generally speaking, riders will spend a fortune on getting the horse physio, the horse osteopath, the horse chiropractor, the horse massage therapist, the horse dentist, the horse homeopath, the horse crystal therapist, all of these things, the saddler, the lessons, all of that. But they don't necessarily always realise that putting themselves, who are probably crooked, asymmetrical, not functioning properly, on a straight saddle, on a straight horse that's had all this treatment, is not necessarily the best idea. It's a task to be taken on, and it is improving, absolutely definitely, that the rider actually treats themselves as an athlete and a massively important part of that partnership. So, as I said to you before, your riders will probably be carrying old injuries, and quite a few of them. And I just want to show you this little video of one of my clients, actually, and she will tell you a little bit about her experience with biomechanics.
Hi, I'm Wilcox. I'm a professional rider and producer of Liverpool sales based in Nottinghamshire. The sport of eventing is a bit of triathlon for humans, and in the sport we do a dressage test, which is a series of movements that we get marked individually for. We then go on to a round of show jumps, which tests how agile and as a rider, how capable of changing disciplines you are, and then we go cross country and jump over very solid fences at speed. Last year, unfortunately, I broke my spine in a riding accident in which I broke my lumbar vertebrae. And after the surgery, which involved some metal rods in my back, I was told that I wouldn't be able to ride for a year. Very competitive, and I really enjoyed my riding, so there was no way I was going to let that happen. Once I was discharged from the hospital, I embarked on an intrinsic biomechanics course with Lindsay and Reid. And during the sessions, we did a number of anti-spasm exercises on various parts of the body. I was given these as homework, and I did them about 4 times a day. And what I felt after doing these exercises, I felt more comfortable and looser in my body. When I rode the horse, I felt more level, which allowed them to follow my movement and be comfortable again, seeing as obviously the spine was a little more rigid than normal. It made me better, feel of well-being. The fact that I really feel that without the biomechanics, I wouldn't be back to doing what I'm now competing at quite a reasonable level. And horses is my job, so I do feel that without the exercises, I'm going to somebody that actually understands about riding and how it goes from normal therapist, how to put my foot really sooner. I think it's really important to go to somebody somebody that understands your sport and what you do, because if you don't, then I just don't really think you can make the recovery that I have done.
Okay, so what Hillary didn't mention on that little clip was that she was out show jumping and winning 3 months after that accident, which was quite a significant achievement. You know, she's very focused, but you will get these people that are just, you know, if they're told not to do something with the horses, it just goes over their heads, so they'll be doing it anyway. I'd like you to just, in a second, we're going to just do a little activity, just to wake you up a bit. And I want you to just feel a little bit how the rider's body has to move when it's on the horse. We have to strike a balance between being mobile and also stable. People that have done a huge amount of core work sometimes lack the necessary flexibility of biomechanics to actually absorb the horse's movements. And likewise, if people are too floppy and they're not able to resist any unwanted movement forces from the horse, that's not helpful either. So I'd like you to just stand up if you can extricate yourselves from your little space chair. Okay, so I'm going to show you another little video of this in a minute, so hopefully this will all make sense, but you're going to have a little play with it. So as the horse starts to move, the horse's back starts to lift the rider. Now as the horse's back starts to lift the rider, what happens is the pelvis is rolled backwards. Okay, so you're taken into a posterior tilt. What happens to the lumbar spine? You will do this as well. So what happens to the lumbar spine when the pelvis goes into a posterior tilt? Flexes, yes. And then this cycle of energy is taken up through the rider's spine. So as the lumbar spine flexes because of the posterior tilt in the pelvis, what do you think happens to the rider's upper body? Yes. So that does the opposite. So we get flexion here, backwards, and then flexion forwards with the rib cage. What do you think happens to the rider's head? We've got that and that. So put your own bodies into the position. Yes, extension. Massive habit with riders to be looking down, so that might be restricted a little bit. But yeah, that would be the natural kind of cycle. So that's when the horse's back lifts. When the horse's back drops in the next phase of gait, that all reverses. So what we get is anterior tilt of the pelvis. What happens to the lumbar? Yeah, extension. And then in the rib cage and thoracic, extension. What happens to the head and neck? Yeah. So that is one plane of movement that the rider has to absorb. Now, at the same time as that happens, we also get, when we get the flexion of the spine, we get this motion, thank you from earlier, with the shoulders. Now, and the chicken wings also that Martin was mentioning. And then when the opposite happens, when the spine reverses, we get this happening. Now that has to happen. If there are restrictions in the pelvis and the lumbar spine, do you think that would be particularly easy for the rider to achieve? If there are restrictions in pec minor, any of the rotator cuff muscles, do you think that cycle would be particularly easy to achieve? No. So that's one type of movement. Oh, we should do all this as well. So the next type of movement we have to absorb is the horse will lift one side of the rider's pelvis. So we get like a hip hitch. So what do you think happens in the rest of the body, the rib cage and the thoracic, when we've got a hitched hip? Goes to the way? Yeah, so we get that, and then the head does the opposite. So we've got this constant cycle of frontal plane movement as well. So that's another plane we've got to absorb. And we also have horse's stride movement that takes one side of our hips forward. So if you just take one hip forward for me, what do you think happens to the upper body when that happens? Yeah, so we've got lots of these oppositions going on all the time. You can sit down. Thank you. So we've got lots of these oppositions going on in the rider's body all the time. So it's not just sitting still on a horse. The very best riders will actually be able to absorb a lot of this through the pelvis and the hips. So it doesn't look like there's a lot going through the rest of the body. But that is what's happening to us at greater or lesser degree depending on the rider's and biomechanics. When the pelvis is tilted backwards, what we get is the hip joint extends, the knee flexes, and the ankle joint goes into plantar flexion, so the heel's drawn up. When the stride changes and the back drops, we get the absolute opposite. So as the pelvis goes into anterior tilt, we get hip flexion, we get knee relative extension, and we get dorsiflexion through the ankle. And this is what I call the seat-feet connection. And I just want you to have a little look now at some of this in action. This is my skeleton. So hopefully you'll be able to see that. So this is a horse walking, and you'll be able to see the slight lateral movement through the pelvis. This is from the side view. So there's quite a lot going on there. And there are a couple of different horses for you to look at, because the different horses have a different influence. This is me exposing myself. I'm the fattest skeleton in the East Midlands. This is my very unflattering skeleton suit. But anyway, all in the sake of science. So this is the rising trot that the riders are having to absorb. And also it's a bit squashed. Perhaps it's the video orientation. And then we've got the sitting trot. Now you'll be able to see this really clearly in terms of that cycle going up and down the rider's body. So the changing position of the pelvis and how the legs change, the ankles and this sort of thing. Now what we're looking for is the rider to maintain a fairly vertical position generally as the horse is moving. But the spine and the joints are all kind of moving and working within a framework of what we call neutral spine. I'm sure you will call neutral spine as well. So a transition to trot, that's where the horse moves from walk to trot. Transitions between paces of prime time for the rider to lose balance, or the horse to lose balance and go into their preferred movement patterns. So you can see that the amount of movement that the rider has to go through with the pelvis and the spine, it shouldn't be huge, but it is there. And the next horse that I'll show you, or you'll see sitting trot, and you'll also see that sideways kind of left, right swing. Now this horse gives more of a left-right swing in his movement than this horse. This horse has more of an up-down motion in the gait. I'll come back to that in a second because there's quite an interesting point to do with different horses' movements. This is just showing you a few simple dressage movements where the rider has to be able to maintain that upright spine and absorb the shock, but slightly change the weight distribution in the saddle. So for instance, I've got my weight over to the left here, whereas in this movement here, I've got my weight over to the right. So subtle changes within the rider's seat give the horse instructions on how to move, as well as leg and hand pressures. You'll see it switching now. You'll see the rotation in my body slightly alters. So being able to turn the body and slightly change weight distribution, again, helps us to get our signals to the horses more and more subtle. So having quite an efficient pelvis that allows that to happen is absolutely vital. But with the chestnut horse that you saw, you can see that if the rider had restrictions that would limit that left-right kind of action, then that's going to impact on the horse's gait patterns and an ability to perform the movements. These are not particularly high-level trained horses, so they're just fairly basic at the moment. But you'll see a couple of more difficult lateral movements in a second. It's just interesting to see the spinal movements. So this horse has less of a left-right swing than the other, but you'll still be able to see it. Excuse me. So sitting trot is a big reason why people come, certainly to me. They feel they can't absorb the shock, they can't move with the horse's back in the sitting trot, especially with dressage riders. Dressage, of which I am one, and I class myself as a little bit anal and a control freak. The dressage riders will probably be that type of person. Your people who go jumping are a little bit more of the adrenaline junkies. So you can see that there's a lot of movement there that has to be absorbed through the joints and the bones of the rider's back. Changing the amount of movement consciously through the pelvis can change the horse's strides. So in canter, the rider passes from sort of here to here, but vastly increasing that distance will actually encourage the horse to change his own pattern. So you can see an itch, I'm exaggerating this, you can see a funky little movement there through the rider's body that happens when the horse does what's called a half pass. So these are just some still shots that show you, we call that fairly neutral, so that's the midpoint of that movement, but we're changing in the spinal orientation all the time. So you'll see the difference in the leg positions, the joints of the legs, and the same in the trot. See, heel up, knee flexed, posterior tilt, and then the complete opposite, and then somewhere in the middle. So we have to be able to move through all of those positions and postures whilst maintaining a level. Now, I need a guinea pig for the next bit, because these are some simple techniques that you can use to help your clients actually transfer the skills that you're going to be using with your entrance in biomechanics to actually on the horse. So we're making it functional. So if anyone would like to come and have a little seat on my saddle horse, that would be incredibly helpful.
Very keen one back here.
Yeah, come on. Thank you very much. So just done a little okay, so I leave your feet out. So one of the major points that the rider can use to sense whether they're actually level in the saddle is how their seat bones feel when they're in contact with the saddle. I'm not going to go through the whole thing because it will just take far too long. But just some little awareness pointers will help. Now, riders do need to feel their seat bones in the saddle. They need to feel both of them whenever they actually take their attention to it. They're not going to be thinking about it all the time because there's too much other stuff to be aware of. But I want you to, sorry, what's your name? Rose. Could you, for me, find your ASIS bones for me? And you can do this in your chairs if you want to. Put the heels of your hands on those bones. Yeah, and then you're going to find the top of your pubic bone with your second or third fingers. Brilliant. Feel through bones? Yeah, excellent. So Rose has made a triangle shape now with her fingers, so she can feel that. Now, to help your riders find the right part of the seat bones that they need to be sitting on in the saddle, we're going to imagine that the pelvis is a bowl of water sitting on the saddle. Now, what I'd like you to do, Rose, for me, is just see if you can spill all the water in the bowl onto the back of the saddle. So that, yeah, brilliant. So the back of the saddle is called the cantle. So this flattens the back out. Can you feel now that the ASIS are further away from that wall than the pubic bone is? Yeah? So now we're going to go the opposite way, and you're going to tip the water out the front of the bowl onto the pommel. So the front of the saddle is called the pommel. So you should be able to feel now that the ASIS is much closer to the wall. So what we're looking for is neutral pelvis, where that triangle of bones is on a vertical plane. Okay, you right? How does that feel? Pretty central, okay. So, in terms of the pelvis, in fact, the whole of the rider's body, those three bones should be on a vertical plane. And whatever the rider can feel at that point in the seat bones is what they want to be able to recognise when they're actually on a horse. I can't stress how valuable it is to get the riders in the saddles so that you can get them to be aware of this in a realistic position. So however much you do on the floor, on a mat, on a gym ball, it just doesn't feel quite the same as it does when you're sitting in the saddle in terms of being aware of the light and that sort of thing. It still doesn't feel quite the same sitting in the saddle on a saddle horse as it does on a real horse, but there we go. So imagine the rider's body is a stack of boxes. We've got the pelvic box at the bottom, the rib cage box here, and then the head box at the top. Now all of those boxes can individually move, they can all tilt, they can all twist, they can all shift side to side, and this can also shift forward and back. And as you've seen from that little video, we do kind of pass through all of those possibilities while we're actually moving on the horse. But as a rider, we need to be aware of where central is, where that box stack is everything is facing forward. So we can choose to move in and out of it. We can choose to apply different pressures if we want to. So helping your riders find a neutral pelvis in the saddle is important. And feeling the seat bones. Does that feel all right? Yeah. You're not left and right level. No. In terms of forward and back, that sort of sensation is wants to be where you want to be. Now, if a rider's got low-grade spasm going on around the pelvis, it can make the seat bones very, very difficult to actually sense. So if a rider has got a low-grade spasm in the glutes, the piriformis, the hip flexors, the QL, it can keep this pelvic box or bowl stuck in rotations, tilts or torsions. And however hard they try, they're not going to be able to feel level seat bones until they've addressed those issues. So I know when I started the programme, the difference I felt from my horses, the feedback from the horse was vast. The horses are incredibly sensitive to the small changes in intrinsic biomechanics that you can achieve. And interestingly, riders are often masters of compensation. So although, as I said before, the person sitting like this on a horse isn't going to be terribly helpful to that horse's way of going, you can often find riders that sit in a textbook position on a horse, and yet they've got things going on in their own bodies. The horse isn't quite as free one way as the other because of those restrictions going on inside. I'm just going back to my computer. I need a little. Yeah. Okay, so the rib cage box. So Rose, if you imagine that your chest is a pair of headlights, okay? This is very simple, easy visualizations that the riders work well with. So, all right? Yep. Okay, so Rose's headlights are in a very nice position at the moment. But what will happen with a lot of your riders is their headlights will be on dipped heel, which is not terribly helpful. What can contribute to that, of course, is restriction in the thoracic, also in the pelvis, of course, because anywhere along that energy cycle that gets interrupted will have an effect somewhere else. But the pec minors, the rotator cuffs, that sort of thing. You also get riders that are on dazzle. Okay? We don't get that either. That puts perfect demonstration thanks. Those are so the stacking of these boxes, thanks, that was helpful. The stacking of these boxes, it works a little bit like a fulcrum. So if any one of the boxes are behind vertical, the legs will tend to compensate. So riders that are struggling with leg position can often be helped with working on the pelvis and the lines of the rib cage. Now, what Rose demoed there was when she did her dazzling headlights, is she came right back at the same time, which puts a huge amount of pressure not only on her back but on the horse's back. So the unsupported area of the horse's spine behind their rib cage, that sort of position can do a lot of damage. And people who struggle with their shock absorption often do go into this to try and find a way of dealing with the horse's movement. Okay. So you say that. Now, elbows. I'm going to have to go quickly now, a bit faster. Can I just ask you to just hop off there for a moment and get back to So Martin mentioned chicken wing elbows. The awareness of the elbows can really help riders to know whether they're level or not in the rib cage, because that can be harder to sense. So what I will do is I'll ask Rose to just bring her elbows close-ish into her sides. Now I'm going to make you go a bit wonky. There we go. Okay. Yeah, that's great. So if a rider is wonky like this, and I ask you to bring your elbows just into your side, can you feel the same part of your body on both sides? It feels different? Yeah. Okay. What can you feel on the right?
That's below my head.
Yeah.
And then
so no matter how we go wonky, and you could do this in a chair or whatever, you don't necessarily need a saddle for this, although it is more helpful. Any which way I put Rose wonky, if she brings her elbows in towards her waist, she'll be able to feel that it's different on both sides. Whereas if I ask you to just use your elbows and just have a little snuggle in and find the exact same part of your body on both sides, that acts as a kind of spirit level really for the upper body. which helps the weight of the rider's upper body stay more central over the pelvis. Because this shifting side to side, forward or back, or so on and so forth, can actually give signals to the horse as well as distance. It's a good habit to get into keeping the elbows close to the sides for postural reasons as well as control reasons. For some riders, this is not an appropriate position because they might be riding a young horse or whatever, but that still works even if you bring the elbows a little bit further forward or onto the front of the hips. As long as they can feel the same part of the body on both sides, that will still work. Now, that doesn't need to be done all the time, but it does need to be done on times when it's perhaps more important for the rider to be particularly stable. So that tends to be when riders are making turns on the horses, or changing direction from left to right, or going through what we call transitions, which is changing pace, walk to trot, trot to canter, canter to hold, that sort of thing. Now, breath flow, excuse me, is absolutely massively important. I'll talk fast, Rachel. Massively important for riders because of the psoas diaphragm connection. See, that's why I was very good. So horses are hugely sensitive to breath flow going through the rider's body, probably mostly because of the fact that they're a prey animal, and they pick up hugely on the body language, the amount of tension, breath flow, heart rate of beings around them, because that's how they survive. They have to do that in the wild. They're not in the wild anymore, they still have all those instinctive reactions. So maintaining an even and consistent breath pattern whilst riders are riding hugely helps to allow movement through this part of the body because of the connections through to the psoas, the QL, and also the adductors. So horses don't like being gripped with this part of the thigh, the adductors. And often it's because people are breathing in an irregular pattern or too shallow. And horses will move much more freely if a rider is breathing evenly and also down into this part of their bodies as well. Now, there was a study done in Sweden at a university that looked at 20 riders on 10 horses, and they monitored the heart rates of the riders and the horses walking and riding between 2 points, so point A to point B. Now, they just went up and down 3 times, nothing happened, and then on the 4th pass, bearing in mind they've had all the heart rates monitored, horses and riders, on the 4th pass between these 2 points, the riders or the handlers were told that an umbrella would open part of the way down this little distance. Now, for a rider or a horse, we know that will spook a horse generally. Now, no umbrella was ever opened on any of the passes, but the heart rates of the riders and the horses increased on that study. So we know that the horses are very sensitive to an increase in rider heart rate, and vice versa. But breathing slowly and evenly will actually help to calm an anxious horse, because that will lower the rider's heart rate as well. So it's very helpful to get your hands just below, slightly different place to James was talking about, on the sides and the back of the ribs, and asking your riders to just breathe slowly and evenly. It doesn't need to be extra deep or anything like that. Slowly and evenly into the hands, so they can feel that connection. And then what I do is I slowly work my way down the body, so that they can start to take the breath lower and lower, actually towards the pelvic bowl. And that can really help to release restrictions in that whole psoas diaphragm complex. And again, that will help riders to feel deeper in the saddle, more connected through the seat bones. We can practice that later. We do spend longer normally. That was good. So do pay attention to that. So that is our B of our rider's ABC. Now, whistle stop tour through the core muscles. Very whistle stop. The core muscles can be consciously recruited to help the rider stabilise at times when it's more important for the rider to be stable on the horse than it is to be flexible. Most of the time, as I said, your responsibility as a rider is to move with the horse and not block. However, there are times when it is more likely that the rider will go into their own wonky crooked pattern, or the horse will. And those times are changes of pace, because you've got the extra movement forces of acceleration or deceleration as well. Changes of direction, that's when most riders go into their own little patterns. Sometimes going sideways as well. You saw the horse going sideways a little bit earlier. That's when the riders tend to screw themselves up into funny shapes to achieve those movements. And usually when I ask people, when do you think that you should use your core muscles consciously on the horse, they say when he's being naughty, if he bucks, if he spooks, random occasions like that. And I think that's inappropriate because you can't plan at those times. You can't go through a checklist to kind of organise yourself because it's already happened, probably already on the floor by that time. So that's why, that's the beauty of the programmes that you're delivering with the Intrinsic Biomechanics and then working on the core, that they actually build that up, that support up, without having to consciously engage it. But when they need to consciously engage it, they can do, and that also can give instructions to the horse as well. Now, hopefully we know how to engage the transverses and obliques together, and I'll just show you a couple more examples of what you can show them to help them. So, excuse me, the mid-traps help to stabilise the shoulder blade, which creates a nice base for the horse's contact between the reins and the rider's hands. And just move your hood round. So just fingers between the shoulder blades. If you can very, very gently squeeze my fingers together, perfect. Doesn't need to be too much. Your sort of 20% for your antispasms is perfect. And then just hold your hands as if you're holding the reins for me. Next, massively important muscle for riders are the lats, because this gives them real good stability through the whole trunk. So to get these engaged, what I want you to do, Rose, is bring your elbows in and down towards your hips, so you connect your elbows to your seat bones like that. Okay? Now if you put your fingers just either side of the rider's spine and ask them to do that and release it a few times, they'll be able to feel that tension increase slightly under your fingers. Okay? Got that? Brilliant. So again, relax. They can use that at times when they particularly might need a little bit of support. Doing those sort of things gently can just provide them with a bit of stability in their general riding, but doing those more strongly would start to give actually instructions and signals to the horse, which we haven't got time to go into, sadly, and whether it would make any sense, I'm not entirely sure. Glutes is very important, or are very important. If they are constantly engaged, which they are with a lot of riders, just squeeze your bum for me a bit. Can you see how she lifts out the saddle? A lot of riders will squeeze and keep them on all the time. That brings the seat bones out of the saddle. It also keeps the brakes on the horse. So having a rider aware of actually keep relaxed in the glutes can then make it more efficient when they might want to use the glutes for stability or instructions. But again, if a rider has subclinical spasm going on there, they're tight or restricted around the glutes, they can't relax them, and then they wonder why the horse doesn't listen to their signals through the body. So another really important point there. So that really, again, in conclusion, is a whistle-stop tour of what I call the rider's